Is Restylane or Dysport better for bags? I can't tell if I have hollowness or bags or both. In mid-20s and need these gone now.
Thank you for your question. You submitted your question with a photo. You blocked out your eyes, I'm assuming to try to hide your identity, and you are asking what's better for the bags, Restylane or Dysport, and you can't tell whether you have hollowness or bags or both. And you state also that you're in your mid-20s and you want these gone now. Well, I can certainly share with you how I counsel patients like yourself in our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping people with under-eye hollows and bags, or both, is something that has been a big part of my practice for over 20 years. And we live in a very good time where we have a lot more tools and options to really customize a treatment plan that is ideal. So I think it's important to also understand, certainly in the way you ask the question, that there is no either or. There's really a strategy. And I think what gets confusing for people when you do your research is that there's often bias by practitioners or instrument providers, whether it's lasers or non-surgical or whatever someone wants to sell, they'll always lean towards their particular bias. And I think that a proper evaluation should at least inform you as to what are the anatomic issues and what are the optimal strategies to maximize the appearance of your eyes. So let's begin with analyzing your eyes just with the photos. So there are under-eye bags. What are under-eye bags? Well, under-eye bags mean that there's something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around your eyes has pushed forward and created a bulge, and that bulge results in these puffy under-eye bags. Now, many times people don't always appreciate the bags because they also are bothered by what they perceive as the hollow areas. Now, typically the hollow area means that the patient or the individual is concerned is bothered by the area just below the bags, and that area is referred to as the tear trough. And the tear trough is a relative hollow because the valley, which is the tear trough, is deep because of the relative projection of the mountain, the under-eye fat pocket. Now, years ago, it would have been a straightforward discussion where I would simply say, well, you have lower eyelid fat prolapse and that you should undergo a cosmetic surgical procedure. Now, many times people in their 20s are aghast by that idea and say, well, I'm much too young to have surgery. And the reality is that that's not really the case. You do surgery when it's appropriate. However, when we see a lot of our patients who come in with a similar situation, I try to determine whether or not there is a potential value in doing a procedure such as an injectable filler, such as Restylane, as you asked in your question, which is a filler. And using a filler to fill part of that deficit that is perceived, which means filling the area in the tear trough. And we can essentially help our patients look better, even though not definitively treating the under-eye bags. And a lot of times that what we basically say is you're essentially buying time, you're getting an improvement, and a lot of times our patients say, well, I would love to do the surgery and I realize these bags are really significant, but I'm not going to have time from work for at least another year. So maybe we can just do the filler for now. A lot of times the filler can also be a good strategy for years. So placement of filler in this area could potentially be a benefit. What is the limitation? Where is the line? Well, the line is when the relative projection of the fat pocket exceeds significantly the area that can be filled with filler. We see patients all the time who have come from other practices because they got filler and the patient feels like their under eye bags are actually worse. And you can see how that can happen. A doctor who either doesn't do surgery or is trying to accommodate the desire of a patient may place filler and end up creating a double bag by creating so much volume, and a lot of times this area can actually swell significantly. So we end up using hyaluronidase to dissolve the filler and then see what the actual anatomy is, and then either come up with a strategy of using alternate fillers or doing surgery. The surgery involved with the lower eyelid fat prolapse, just to complete that first idea, is a procedure we do in our practice called transconjunctival blepharoplasty. Transconjunctival blepharoplasty means I'm basically addressing the fat pockets from the inside of the eyelid. And by doing that, I'm avoiding any external scar, I'm retaining the natural shape of the eye, and I'm doing something that is more definitive and, of course, long-term. A lot of patients are afraid of surgery because they're afraid to go under general anesthesia. They're afraid of the potential complications. And of course, those are important. So in our practice, what we do is we do these procedures under local anesthesia with light sedation, which is avoiding general anesthesia. There's no tube in the throat. And we're able to do this in our office in our Joint Commission approved facilities. That way the safety and quality is there, the avoidance of hospitals and surgery centers, and the convenience is also very nice. And pretty much in a week, most people go back to work. So it's not always an either-or situation also. Sometimes what we also recognize is the tear trough area and the cheek area, which is very important in the relationship of eye aesthetics. I always say look at both the eye and the cheek to have true balance and harmony to get optimal appearance. Again, for someone in their mid-20s, very often they're not really ready to do fillers as someone who is more ready in their mid-30s and later. But nonetheless, it is important to recognize that there is volume that is genetically maybe considered to be somewhat deficient that could be addressed in the cheek area. This is where a procedure we call structural volumizing has a potential value. Structural volumizing is using a filler that is on the thicker side, such as a Juvederm Ultra Plus or Juvederm Voluma, and placing it in the cheek area below the eye so that the area between the eye and the cheek is more balanced. And when you have volume in the cheek that's just right, not overfilled, but just right, then it looks really, really nice and it really blends well with the under eye area. So I think it's important that you meet with the cosmetic surgeon, a doctor who is able to both do surgery and injectable fillers and who has a lot of experience in this area. And I think it's very important to get a realistic understanding of what is an optimal strategy for you and what works for you in terms of your needs. So I hope that was helpful. I wish you the best of luck. Thank you for your question.